Good afternoon, everyone, and thank you for joining us on the news briefing for this Wednesday. Natividad Medical Center is marking a very important milestone this year. It's the 10th anniversary of its Level 2 Trauma Center designation. Now, since receiving the designation 10 years ago on January 5th, 2015, Natividad has transformed itself and the region's emergency medical services landscape, saving lives and serving thousands of people. What will the next 10 years bring? We're very pleased to have two people to talk with us about this important milestone and accomplishments and what is next. We have Dr. Alexander Stante, who's the Trauma Medical Director and Surgical Services Director at Natividad, and Julie Ramirez, who's the Trauma Program Director and a Trauma Nurse Practitioner. Thank you both for being here. Dr. Stante, I'm wondering if you'd like to start us off about how Natividad is looking at this milestone.
Well, we're very happy and proud, and that we accomplished it 10 years ago, and it's a real asset to the county. As people know, before we were a trauma center, there was at the time no level 1 or 2 between Santa Barbara and San Jose, and now we see approximately 1,400 a year, so we've seen probably around 14,000 patients in the last decade.
And and Julie, I don't know if please feel free to jump in here. I'm just wanting to get like a picture of, I know 10 years has been a long time and a lot has been accomplished. There's just no way to wrap that up in a few minutes, but I know that you guys want to talk about, where we are now versus where we were then.
Well, we've certainly come a long way, and it's pretty impressive, and it's hard to believe that 10 years have passed already. But Natividad has changed tremendously in regards to the services that we provide here. And it's pretty amazing to see how things have fallen into place, and how we've been able to recruit locally experts to care for our patients in our community. I was here before we became a trauma center. I've been here for over 20 years, and to see the changes that Natividad has gone through, and to see the trauma system come together because of having a local trauma center, working with our pre-hospital providers and our different agencies, and developing services within the hospital. We really have come a long way, and it's pretty exciting, and it's neat to look back on the previous years to see this journey that has gotten us here. And now we're able to confidently look at how we've improved the health outcomes of patients in Monterey County, looking at patient outcomes, lives that have been saved, as you've seen with some of the testimonies that have been shared with the public, and just being able to benchmark with other top-notch trauma centers, and that we're very comparable with. So it's pretty impressive, and it's definitely a time to celebrate.
Well, and it's not to say that Natividad wasn't ready for the designation either. And I think that people may have forgotten that in order to get this designation, the hospital had to prove it was ready, and it was ready to just take off as soon as they got the designation and go. And that is what happened.
Yes, absolutely. There was a lot of preparation involved in regards to preparing staff, providing education, recruiting specialists and surgeons. And we had to have basically processes, policies, guidelines in place before becoming designated to prove that we could handle being the trauma center and receiving patients here at Natividad and coordinate all services together. So there was a lot of preparation involved, and this continues to this day, the oversight and management to ensure that all of these entities align perfectly to continue providing these resources.
And Dr. Stante, I'm not sure if you're in a place where you can't turn your camera on, or if you could turn your camera on. I was hoping you might talk about what is the difference between the type of patients that Natividad can treat now with this level 2 versus what they could treat before. Because we've had some pretty significant trauma cases that have happened in the last 10 years that simply would not have been able to be cared for right here versus, flying them or airlifting them and, not wasting, but taking precious time versus treating them.
Well, the easy answer is before we were a trauma center, no one in the county was equipped to manage any kind of trauma that should have been designated sent to a trauma center. Now we are at a level where we can manage the same level of trauma as a level 1. There are basically four levels, really. 2 of them, the first 2 are the most important because they take care of the whole spectrum of trauma. The level 1 and level 2. The level 3 doesn't have neurosurgery, and so most of the things they manage are minor things in orthopedics and things like that. But as a level 2, we have fellowship trained trauma surgeons and orthopedists, as well as the neurosurgeons. So we, before we were open, we weren't able to take any of that, 0. So when you ask what types, 0. What types now? All types.
And one of I think your most famous cases in the last year or 2, I believe was a gentleman who was attacked by a shark. And I'm just thinking of the amount of time that it would have taken for him to be airlifted to somewhere else versus getting to Natividad. I think really may have really been the life-saving time.
Yeah, you're correct. So, when you think about it, before we were a trauma center, the plan for the county was to transfer all traumas that met field triage criteria. So when they looked at the numbers, when the EMS at the time looked at the numbers, they found that they were flying out somewhere in the range of 250 patients out of the county before us, which tells you if we're seeing 1,400, what was happening to the other patients, right? They were either not making it out of here or staying and not at a trauma center. So yeah, it's a huge lifesaver to have a level 2. It decreases mortality, it decreases morbidity, complications long term. So it's super important that we have one.
And then, so here we've hit this milestone at 10 years, and you were saying you're really doing level 1 work. If you're already at the top, where do you go from here? Because now what are you going to look at in the next 10 years? How do you keep that going? And then how do you do more? Which I'm sure that's something you guys think about every day.
Yeah. I mean, the main thing is to maintain the highest standard. We are verified by the American College of Surgeons, and that's a review that occurs every 3 years, and so it's coming up this year, as a matter of fact. And Julie's really the one that's instrumental in maintaining all of that, the data and the oversight of the system. And so that's mainly what we go forward, is keep improving. The difference between the level 1 and level 2, you'd have to have a residency and do research. So unless you start a surgery residency, usually those programs are in, Stanford, UCSF, UCSD, North. There, Valley is one as well. But you have to be a teaching center for surgery.
And Julie, so your thoughts, especially someone who's been here for so long and seen Natividad before and after, and this really is a sense of pride, I think, for our community to be able to have this. I think people don't know how lucky they are to be able to have this type of trauma center right in their own backyard.
Absolutely, and I think we all feel that responsibility to maintain the standard of care of the trauma center and the requirements to be verified with American College of Surgeons. That duty is to our community, and we do carry a lot of pride. And when you talk to staff at Natividad, especially people who've been here for a long time and have been part of the change, and continue working really hard to meet these good outcomes and make sure that our patients ideally return to their previous level of functioning after a traumatic event. There is a lot of collaboration here, and it is very heartfelt. So yes, it's pretty special. We definitely feel that here.
And I think we probably would be remiss if we didn't remind people that while you have a level 2 trauma center, Natividad has services for everyone, from the smallest resident to the oldest resident and everything in between. You don't have to have a trauma to come and get services at the hospital either. So I just want to give you the opportunity just to share with the community, to come see you, whatever needs you may have.
And that aligns with our mission of Natividad, that we are here to care for the community, regardless of your background, regardless of your ability to communicate, language or pay, or what your need is. We provide all levels of services here for the entire lifespan. We are just fortunate to be able to provide expert services related to surgery and trauma care. And that's in addition to everything else that we provide here.
Well, this milestone is really something that I hope everyone at the hospital is celebrating. I'm not sure what the hospital does to celebrate. I don't know if you can have cake or if you have to have fruit cups, but hopefully you can all, take a moment and just really celebrate the milestone.
Well, we definitely are acknowledging staff, and this brings me back to the day that we did become designated as a trauma center, and this was January 5th of 2015. And I remember it clear as day. We had a conference room that was reserved, and representatives from almost every department. We were just spilling out of the conference room. Representatives at Natividad, employees here were waiting for the determination if Natividad would receive the designation. And once it was determined and it was broadcasted, you could just feel the hospital vibrating with just life and excitement and motivation. So it's pretty exciting to think that we're 10 years down the road from that, and you still feel that feeling from the staff here. So I think moving forward into the future, I'd like to keep that same energy going with our staff and the pride of working at Natividad.
Thank you both for talking about this great milestone and anniversary. And I hope you keep those good, exciting feelings going, in this anniversary year, and then, of course, into the future.
Thank you so much.
Thank you both.
Thank you.
Thank you, Dr. Stante.
Have a good day. Bye-bye.
Now, on to our next topic. Among the many programs within our county's health department is a public health cannabis education program. Now, did you know that cannabis is the second most often substance associated with impaired driving? That is why making sure that teens and young adults are fully aware of these dangers. There is a major new grant, and it is going to be funding outreach to teens and young adults about the dangers of driving while under the influence of cannabis, and hopefully reduce incidents of drug-impaired driving. So we are very pleased to have Vivian Availa. She's a chronic disease prevention coordinator with our health department to talk about not only the grant, but what the grant will fund. Hi, Vivian. Thanks for being here.
Hello, thank you for having me. So I'm going to share first just the background of the grant and share what we had released in our press release. So the County of Monterey Health Department is pleased to announce that they are the recipient of a $206,065 grant from the California Office of Traffic Safety to support the public health cannabis education program. So this grant will fund community educational outreach and a public awareness campaign to engage teens and young adults, inform them of the dangers of driving while under the influence of cannabis, and reduce instances of drug-impaired driving. And to share a quote from Elaine Narciso, Health Program Coordinator from the County of Monterey Health Department. We are excited to receive this grant, which will allow us to enhance our efforts to prevent drug driving and promote safer roadways. With education and awareness focused on youth and young adults, we aim to reduce crashes and injuries caused by driving while high. Our goal is to shift community norms around driving while under the influence and promote safer driving behaviors. According to the Centers for Disease Control and Prevention, cannabis is the second most often substance associated with impaired driving following alcohol. Cannabis use can actually slow reaction time, decrease the ability to make quick decisions, and reduce coordination that can lead to poor outcomes on the roadways. So grant funds will support various activities, and it's going to allow us to enhance our drug driving efforts, including a risk reduction social marketing campaign to encourage cannabis consumers to avoid driving while under the influence of cannabis, increase drug driving awareness through distribution of print and digital materials for teens and young adults, and also drug driving prevention workshops for teens to address the dangers of driving while under the influence of cannabis and or alcohol. Education plays a pivotal role in creating a strong road safety culture that prioritizes traffic safety. And by addressing the underlying issues associated with impaired driving, the campaign can successfully bring awareness on the dangers of driving under the influence. This is a quote from the Office of Traffic Safety Acting Director, Jessica Chan. Our grant-funded activities will run through September 2025. And funding for this program was provided by a grant from the Office of Traffic Safety through the National Highway Traffic Safety Administration.
Thank you so much, Vivian, for giving us a rundown on that. You mentioned some of the things that the grant will fund, but maybe you could talk a little bit about some of the things that are currently happening and then how the grant will expand on those. Because I think you're already doing some social outreach, but if for people who may not have seen it, they might want to take a look out for it.
Yeah, so we are already as a program doing educational workshops. And so we do that for youth, anywhere from 6th to 12th grade, providing cannabis education from a non-judgmental, non-stigmatizing way, so that we can encompass and reach all adolescents. And then we also do educational workshops to parents. However, those do not have a focus on drug driving prevention. So this will be the first time that we'll be including that as part of our education. And so it's really going to allow us to enhance the efforts that we're already sort of working on and also develop new partnerships. So we're in the process of finalizing a partnership so that we can actually deliver these workshops as well.
And when you do these workshops, are you targeting a specific area, or are you just kind of trying to reach the full county area? Because we've got a big county and we've got youth everywhere.
Yeah, so they're intended to reach youth throughout the county.
And then, so this particular grant is targeting youth. And do most of your programs target youth? Because, the yin and yang of cannabis is that now that it's legal to use, people of all ages use it. So, I'm sure that there's a need for reminders for adults as well to be smart about their use.
Yeah, so this is the second time that we have received an award from the Office of Traffic Safety. This past year, our Office of Traffic Safety grant really did focus more on that young adult piece to address cannabis consumers. And so we are still continuing some of that. The work from last year, and I will say we were able to reach most of the dispensaries, so that was an accomplishment, by providing educational materials to them. And they were related to addressing drug driving. And also we attended this past year the festival called Cali Roots in Monterey. And so that at that festival, we were also able to distribute discount vouchers for Lyft. Also to encourage cannabis consumers to use alternative modes of transportation. So this past grant did allow us to reach the young adult cannabis consumer population, and so we are still continuing some of that by through our social marketing campaign as a part of this year's funding.
Your outreach to the dispensaries, were they very receptive to having educational materials there just as the consumer comes and makes their purchases, just that they can make it available, they can hand it to them, they can pick it up?
Yeah, so the intention was for the educational materials to be provided to the consumers at the point of sale. And really my approach was to provide them to the dispensaries, and how they wanted to distribute them really was up to them. So I left that up to the management or the owner of the dispensary. And so it really varied, and we were able to develop some partnerships with some of them, so that they were actually able to help us in developing the language on the materials, so that they can actually reach the population that we are, trying to reach.
Well, the dispensaries know their customers, so getting feedback on that certainly helped you. So you were able to refine that. Will some of that refinement be in play for this grant cycle?
Yes, so we are still continuing to utilize and tap into the cannabis industry to continue developing some of our materials and to get feedback, because as you mentioned, the cannabis industry, the dispensaries, they know their consumers best, and so we want to make sure that whatever we create is going to reach our intended audience.
Vivian, thank you so much for this. If people wanted to get into contact about the program, find out more, maybe there are people who'd like a presentation to a youth group or a high school, how would they go about getting information?
So if you just search up Monterey County Cannabis Education Program on Google, our website should pop up. That is one way. Everyone is also able to email me directly. My email is actually avilav1@countyofmonterey.gov. And we also have an Instagram and Facebook account. Again, it's just under the name of Monterey County Cannabis Education Program. So people could reach us through any of those platforms. And we are always open to doing parent presentations and youth presentations as well.
Vivian, thank you so much for being here to talk about this. Congratulations on getting this grant again and for being able to continue all of your good works.
Thank you so much.
And now for our final topic, last but of course not least, our Monterey County Works Cadre programs. We have talked about them before. They have helped hundreds of local young adults earn while they learn a skill. The next Green Cadre program is launching in February. And this particular cadre, all of them have been very successful, but this particular one has been very successful in environmental work. And we've heard great stories and success stories about people getting into the cadre program and then getting jobs in an environmental work, which is exactly what the outcome is supposed to be. So we're very pleased to have Michael Artalejo, with a job placement coordinator with our Monterey County Works, to talk about the next Green Cadre program. Hi, Michael. Thanks for being here.
Thank you so much for having me. I do appreciate the opportunity to talk about the Green Cadre program. So yeah, we have a new cohort that's going to start February 24th. We're going to continue to reach out to everyone within Monterey County between the ages of 18 to 24. This program starts off with certifications that we cover: OSHA 10, HAZWOPER training, food handler service training, and power tool and chainsaw training to prepare these individuals for certifications for after and during the program. Like we spoke about, the climate control side of things are one of our primary focuses. We partner with the California State Parks and the City of Monterey, doing fuel mitigation, planting natural vegetation back into our state parks, disposing of and weeding invasive species of vegetation that's not native to our land. So we're one of our taglines is explore and restore. So we're going into these parks and making sure that we are trying to put them back to before we changed them. So through this program, they get mentorship, they get to make an hourly wage and lead projects within the state parks, whether it's planning new areas. And anytime you walk the trail along Fort Ord and Marina State Beach, you're going to see some of the work that the Green Cadre has been doing. And in addition to that, we also focus on food insecurity throughout Monterey County. This last cohort that we just had ended in December, and they were able to package more than 3,000 food parcels and help distribute. I think it was a total of about 6,000 parcels that they actually physically distributed. And the calculation says that that's around 11,000 to 12,000 individuals that were being fed by this food that they helped package and distributed. And of course, during the holiday seasons, the very special 750 pozole kits that they got to help put together and distribute throughout the community. So this is ongoing. Again, we're trying to encourage those individuals 18 to 24 that are interested in food insecurity, but also interested in that climate. We were able to place individuals into positions with the California State Parks and our current most recent partner with the city of Monterey. We have an individual that is now working directly with them. So it's the connections that they make, the opportunities and doors and certifications that help lead them to their next career. And that's what we're ongoing to do. So if you have any questions or concerns or have any referrals, we'd love to sit down and talk with these individuals and give them an opportunity to work hard and be satisfied with the work that they do throughout the community.
Michael, could you also give contact information if someone wanted to apply or find out more? What should they do?
They can go to our website, MontereyCountyWorks.org. I'll also put our flyer, Green Cadre flyer, in the chat that'll have a QR code, and that you can spread the word there. I'll also put my email and my telephone number in the chat also. So if feel free to spread the word. And this is just one of the facets of the program. This is our most popular program that we have through Monterey County Works. But we also do cohorts for CNA programs, truck driving, getting your truck driving certifications and licensing, and work experience and mentorship. So if you know anyone that's interested and not sure what the next step is in their career, we can help out there. Or if you're an organization that would look to want to mentor someone, we pay them an hourly wage in order to get that experience under their belt. So yeah, I will make sure and put the information in the chat, and please spread the word.
And then, Michael, I was hoping you'd take a minute to talk about the certifications that you mentioned. You talked about the people who are in the program were getting these certifications. Those are really valuable for people who are looking for work. And I wonder if you talk about the value of those, the difference between if you go to apply for a job, having and not having some of those certifications.
No, definitely. We were just speaking about it earlier today, the staff here. We had a couple individuals that they're not 100% sure which way they want to go with regards to their career. They live in South County, and there's a brand new Panda Express that's opening up there. And they were excited at the fact that they have the food handler certification already ready. They put that on their resume, and we have one individual that interviewed last week and another one that's going to interview this week, and that they're interested in that. The OSHA 10 is huge. Specifically, we had one individual who knew he wanted to go into construction, wasn't sure what the steps to take. He came and joined our program. He got his OSHA 10 certification. He got his HAZWOPER 24 certification, chainsaw and general power tool certification. Once the program was over, we helped him apply. He did get a position with a construction company working. He's working on a project in Santa Cruz. We actually wanted to give him an award about a month ago, and he was too busy and he couldn't attend the award ceremony because he said he's working too much overtime. But specifically for him, the certifications and the experience that he got through the program, he started his job at $1.50 more an hour than others that would have came in at the same entry level position. So those certifications are big and huge. They give them not only the self-esteem and the awareness of what they've done, and it's a little bit of an encouragement to hopefully put them at the top of the pile of resumes there and make them stand out. And it's been that goes into the work that the city of Monterey and the state parks, being able to have those chainsaw certifications. They know safety, they know the awareness of how to use these things correctly. It's been huge for the individuals that have come out of the program.
You guys really do take a hands-on, one person at a time approach, and it's really paying off. So anyone who is not sure really should get in touch with you and see how the Cadre programs could help them.
Yeah, we look forward to having answering any and all questions and getting the next group up and running. And like I said, we'll be taking applications until February 18th, going through the process and starting out on February 24th. And those first weeks of the Cadre program is we're getting these strangers essentially together, a group from anywhere from 18 to 22 individuals into a room, teaching them about what it means to be part of a team, how to communicate with each other, how to be respectful for each other. Just hopefully those soft skills that will go along with the power tool training and certifications that'll set them up for their next career step.
And success, which I think is what it's all about.
100%. That's what we're looking for.
Thank you so much, Michael, and really always appreciate you being here to talk about programs.
Thank you for having me. I appreciate that.
And thanks everyone for joining us on the news briefing this week. Our next briefing will be next week, and we'll see you then.